Hi, it's October 14th, 2014. This is Susan Duclos from All News Pipeline. I just got off the phone with a confidential source of mine and gave me a little bit of background on the MSM's literal lies on how prepared hospitals are for the Ebola and how not only unprepared, but how they're not following protocols despite what's being reported in the news. First, we're going to go over which incident they're talking about. Now, it says the passenger from Dallas was removed from a flight at Nashville Airport after a health scare, and that an American Airlines passenger from Dallas was taken off the plane at Nashville International Airport after getting sick on board. Flight 1676 arrived in Nashville at 11:29 p.m. Sunday. Passengers reported the person was vomiting and possibly having a seizure. Passenger was taken to Vanderbilt University Medical Center to get checked out. Officials said they are not concerned about this person having Ebola. Now, that was an initial preliminary report. Now, what they are claiming is that he was brought to the Chattanooga's Memorial Hospital, and the doctors and nurses there were already suiting up before they admitted the sick man. And they furthermore are reporting that actually this was a good thing because they've been planning, drills and training and things like that, and it gave us an opportunity to put that into practice. Well, according to my source, not only did they violate every known Ebola protocol at this hospital, and this comes from a medical worker. We're not going to say any more than that. We don't want to cost jobs here. And that what happened at that hospital was a textbook example of what not to do. They say that they were on the spot, and this man was bleeding, body fluids everywhere, and they put him into ICU, and that the attending physician was only wearing basic protection, gloves, face mask, and when he left the ICU where the man was, because of course they determined without testing it was just the flu, he disrobed in a public area with other patients there. Now, due to the CDC carelessness, that's the reason the hospitals are not prepared to deal with this. Now, backing up this, we see that a press release from the National Nurses United, and that was on October 12th, 2014. They say straight up that a survey of 2,000 RNs at more than 700 facilities in 46 states and the District of Columbia have responded to the NNU National Survey. 76% still say their hospital has not communicated them any policy regarding potential admission of patients infected by Ebola. 85% say their hospital has not provided education on Ebola with the ability for the nurses to interact and ask questions. 37% say their hospitals have insufficient current supplies of eye protection, face shields, or side shields with goggles for daily use on their unit, and 36% say there are insufficient supplies of fluid-resistant impermeable gowns in their hospitals. 39% say their hospitals does not have plans to equip isolation rooms with plastic-covered mattresses and pillows and discard all linens after use, and only 8% say they were aware their hospital does have such a plan in place. Now, as I said, the media is reporting, hey, this is a good thing. They've been preparing for it. They were perfectly prepared. At this point, whether the man had the flu, Ebola, the procedures that this source has told me, compared to what's being reported in the media. And my source is backed up with actual words and claims by nurses all across the country. We're being lied to. There's no protocols that are being followed. And it is due to the CDC carelessness. They're so busy trying to downplay all of this, they're not preparing hospitals for an outbreak. We already know that in Texas, an associate of the nurse that has been diagnosed as having the Ebola virus has already been put into isolation. We also know that there's been at least 70 staff workers that worked on the first U.S. patient that died, the imported patient, we'll call him, that died of Ebola in Texas. So we're talking with what, 21-day period before they become symptomatic. We're talking that in 3 weeks we could have double, triple the cases. 3 weeks after that, double, triple that. Hospitals need to be prepared. We were warned that they're not prepared. Nurses are still warning us that we're not prepared. And the media is being fed actual lies, or they're just feeding us actual lies, saying, oh, everything was under control, they were fully prepared. Well, we have a witness on the inside who was on the spot that says, no, they weren't. They violated every known Ebola protocol.